Nolan, very good to see you. Today, we're going to talk through the three big medical costs that retirees tend to underestimate. If you're retiring soon, you may want to budget more for healthcare than you were thinking. According to a recent article from the Wall Street Journal, retirees are underestimating three costs. Number one on that list, Nolan, won't surprise you, medications.
Yeah, thank you, Erin. Healthcare, always an important thing to go over when talking about finances, but more important lately. Medications, I think most people know that medicine seems like it does increase in cost over time. I think that the variety of medications and the types that you take, of course, that varies, and you can get plans to pay for those medications if they go up in cost. Medicare Part D, that's your drug plan. There are different types of things that you can get to help cover those costs, but medications seem like they are an ever increasing cost for most retirees.
Mhm.
There may be caps on a couple essential drugs, but a lot of them they won't cap prices on.
Right. And then next we have what the Wall Street Journal is calling medical isolation, higher costs in areas with limited healthcare access.
Yeah, and this is becoming a little bit more prevalent because there seems like there's a consolidation of care, consolidation of hospitals, healthcare facilities, things like that. When you have these consolidations of, at least in Michigan, when you have consolidations of healthcare organizations and, U of M or Corewell or these other big companies are making these centralized hospitals, it doesn't detract, but sometimes it makes less available to remote people some of those services because the efforts are more centralized. So when I have clients who consider moving out of Grand Rapids and moving up north or moving to the UP, one of our serious discussion points needs to be, okay, if something happens and you're isolated all the way out at the end of this road, is an ambulance going to be able to get to
Mhm.
you? Do
Mhm.
they do snow plowing in the winter? What happens
Mhm.
if you run out of gas and there's a snowfall? Many things can happen. It doesn't need to deter you. You just need to have a plan for these things.
Absolutely. And then last, we have concierge care. In some areas with large, affluent retiree populations, doctors are increasingly turning away patients on Medicare and accepting new patients only if they pay an annual fee for concierge medicine, and that fee is averaging $3,500 a year.
Yeah, this is something in addition to or instead of your regular insurance costs. There's a lot of different ways that people go about it, but this one in particular is something to plan around. A lot of people like to sell their residences, move to these certain communities, maybe like Florida or Southern Georgia or some more expensive states or places like that. And these care facilities are becoming more popular where there's just an inundation of retirees. And if they all accepted Medicare, they would have far too many patients and not enough care providers. So when you have this selection, if you're planning on moving to a retiree community or a highly densely populated retiree town, city, neighborhood, something like that, it's important to do a little research before you go to make sure you're
Mhm.
not falling into one of these areas because
Mhm.
$200 or $300 extra per month is significant for a
Right.
retiree.
And so, bottom line, in retirement, healthcare isn't just about insurance, it's about planning.
Yeah, and planning for everything. We talk a
Yep.
lot about finances, we talk a lot about Social Security and taxes, and we talk a lot about healthcare. So you do have to plan for all of these. It's a tandem effort. It's not just one or the other. It's got to be bits and pieces of each category, each
Mhm.
profession. So
Mhm.
mhm.
Well, if somebody would like to talk to you about creating that plan that incorporates healthcare among all the many other variables that they need to take into account, what's the best way to reach you?
So they can call 616-301-2581, and that's our phone number, or cornerstone-rp.com. There is a contact us box at the bottom. So if you have any questions, you can fill one out there too.
Great. Nolan, thank you.
Thanks, Erin.